which is
Oh,
not as easy as it sounds.
No, it's not. The beginning part's very annoying.
Right.
And I used to have someone at school that helped me with it.
Yeah.
And then it got too much because I was doing 2 a week.
Oh my God.
So he was like, I can't do this.
Yeah.
So now it's just me again.
Right.
But
yeah.
it's fun. I still have cool conversations. I talked to a DJ yesterday.
Oh,
Or
really?
2 days ago.
From where?
He went to Morristown Baird, then he was
Okay.
at Syracuse.
Yeah.
But that was fun. And
yeah.
now I'm talking.
He DJs for.
He's just starting out. He just graduated college.
Uh-huh.
He's goes into the city.
Yeah.
And
Just.
DJs.
Oh, just in clubs, like
Yeah,
in clubs. Yeah. Okay.
So that's pretty cool.
Yeah.
I'm kind of curious. Do you know a lot about the Delta variant?
Oh, we're going right into COVID, huh?
Yeah, because
All right.
like this keeps coming up. I'm like, I don't
So-
care.
I don't think anybody knows a lot, and if
Yeah.
someone's telling you they do, they're full of fluff
Yeah.
and full of themselves. If they're not sort of epidemiologists studying this every day, there's a lot of information and, of course, a lot of misinformation out there. So knowing about it is just following the data for me, and it's too soon to really,
Yeah.
have answers to people's questions. Are we going to shut down again? Is this going to affect younger people? Or is this going to be more deadly? Listen, you can listen to the news. You can listen to people podcasting about it. What are their credentials? What is their data? I don't trust any of it, honestly. So the things that I follow are hospitalization rates and deaths.
Okay.
And, that's what we're all concerned about. We don't, listen, not to say that that's the tip of the iceberg, but, the people that have gone through this disease, have lots of complications and long-term effects. And, we won't know that fallout for years to come. It's like the 9/11 victims and, frontline workers that were affected 10 years down the line with respiratory illnesses and things like that. So, I mean, a lot of this is very difficult for people to accept because we don't have the answers. And I think that's the reality. Now, obviously, when a virus circulates and is allowed to circulate in a community, it gets smart and it tries to change a little bit. And that's why, you keep hearing about and seeing the next variant. And Delta's not the end of it, It's there will be more.
Love Gamma next.
But I'm not an epidemiologist. I'm not a science, molecular biologist. So, I mean, I'm not going to say I'm the expert on any of it.
Yeah.
But I think that, you just have to keep following the data and you have to trust a resource. Johns Hopkins is a very good resource. They've sort of taken front line in tracking this virus, tracking the variants, looking at the real data.
Yeah.
But I think people, can't be like, well, that's, false data.
Yeah.
And, I mean, listen, we got to trust something. And if we can't trust our, major public health institutions, then, that's just your issue, personal issue.
I feel like it doesn't help, too, when the media is just, like, feels like they're blowing everything up. And especially when Fauci, he lost so much credit when he said, don't wear masks to let the healthcare workers get their masks first. Yeah. And then he was like, all right, now you can get your mask.
Yeah. I mean, there's lots of things that, I'm sure everybody wishes they could have done a little differently.
Yeah, that's true.
And like anything else in life, in or out of healthcare, you're going to make some wrong decisions and you're going to have to correct them. Yeah. We're going to just keep living in a wrong decision because you made that decision? No, I mean, I'm happy that people can accept their errors sometimes or admit to that and redirect. This is not very straightforward stuff. So, I mean.
How's it been where you work, though? Has it just been all COVID cases for the past year?
My setting is a little different, and I've, there's definitely different settings that are affected very differently. When COVID first hit, many health care practices were completely shut down. Like, so there was no elective surgery. I mean, the sort of non-essential practices. But
plastic surgery and stuff.
Yeah, plastic surgery, even general, like you're going for whatever, your gastric bypass surgery. Well, you're not getting that in the next, 6 months, right? So it was a little bit of a crisis for a lot of physicians and providers and practices that were furloughed. I mean, a lot of individuals were without a job for a pretty long time in healthcare. And then you had, these needs in the emergency departments that they couldn't even keep up with. So you had people coming out of retirement that were anesthesiologists and, nurses from all over the place, willing and working in the front lines. And that was, that was scary for me with friends, not me personally, but because I wasn't in the ER, but the, that's where the sickest of the sickest presented. That's where people were being put on respirators every day, like at a rate that we would normally in the ER. So you'd intubate us, 20 patients over the course of a month, maybe. This was every day, 20 patients every day. People were putting on a respirator, going to the ICU, dying, and that's the reality of what people lived with, month after month in the beginning. And then, some advances in some treatment. We won't have to get into all that, but, things got better, and then vaccinations, and, we're in a better place now. But that was a horrible time. And for me, I'm trained in emergency medicine and worked in ER until years ago, 2006. And then I transitioned into urgent care. So for our work day, we became very much a outpatient, people that were the mildly ill, mild to moderate. I've had to send some people to the hospital, but not that many. And in the highest acuity of cases, the sickest people I saw were back probably in April, May, June of 2020, and then it became, people understood a little more. Treatment was very specific, outpatient treatment was very limited. It's symptomatic and supportive, and nothing you could really do. We were able to get people in for these monoclonal antibody infusions at, to the hospital places where, at least that became a helpful outpatient. So they didn't have to be admitted to the hospital, but they still had to go through a hospital system or an infusion clinic to get it done. But those, the outpatient, so we became very much a testing center and information, helping people just sort of navigate it, teaching people about quarantine and contact tracing, and there's a whole load of it when it comes to you're diagnosed with COVID now. Okay, that's step one, right? And and what to look out for, and when to come back, and when to get rechecked. And so we do a lot of that. But now it's a lot of testing for people traveling, people returning from other countries, people that have been exposed, people that have to go to a different work, start a new job. So we do a lot of that kind of stuff. And we're starting to see now, in the last month, just a huge number of cases of people with regular common colds. But you can't go anywhere with the common cold now. So you can't be sneezing and coughing. And so they're coming in for testing. And, just in the last week or two, I think we've seen a little bit of an uptick of cases locally in New Jersey and in our area.
How? I thought we were all vaccinated.
Well, we're not all vaccinated, and that there is a bigger problem. But so yes, in our area, we're pretty good. I think our state is about close to 70%.
That's huge.
Yeah, very good. And in Northeast, a number of states are the same in that boat. But you go to other areas in our country, then you could see rates as low as 30%.
That's ridiculous.
That is ridiculous. And the ridiculous part is that people are traveling. So guess what?
And is it infecting people that have the vaccine?
So yeah, we have seen a few cases. However, from the beginning, the data was, very clear that it was always still going to be a possibility, less so, of course, but still a possibility to pick up this virus or a variant of this virus. And, at some point, like the flu and whatnot, we know we'll be looking at boosters and, recreating the immunization to address those. But those people we haven't seen the data that they've gotten very, very sick, needing hospitalization or dying.
That's good.
So that's you have to, I mean, listen, you got to go with that. You got to that's what I mean. So following that data, it's so early. We only start, we're only half a year into vaccination. So think about, I've never had a disease in the time that I've practiced medicine that many people got vaccinated at the same time. So when people talk about all the reactions and the side effects and the possibilities, of course it's going to seem like a hell of a lot because the whole world's getting vaccinated at the same time. I mean, that's never happened. That's unprecedented.
It does seem scary because I feel like they whipped it up pretty quick, because doesn't it usually take like
so
5 or 10
they've been
years
studying coronaviruses for a very long time. It's not like this is a novel new coronavirus, but the study of viruses and immunizations and vaccines has been going on for a long time. And just like any other advance in medicine, this mRNA technology, or whatever you want to call it, is a newer, yes, but we're doing it on a mass scale. So it seems like this just came out of the blue. Yeah. Well, obviously it's not that new for the scientists and the research behind it, but
that makes me.
We don't have choice. We don't have a lot of choices, James, when it comes to this reality of 92 million people in our world being diagnosed with coronavirus, and over what's our numbers? Over 4 million in the U.S. at least.
That's wild.
Yeah, 4 million and something on the order of 620,000 deaths in our country alone, and worldwide. I don't even know the numbers, but it's big.
I think it's silly because we all have to get vaccinations as a kid.
Yeah.
And no one says anything about it, but right when they're like, you need to get this, everyone's like, no.
Right.
I don't want this. Against my liberties. Like, you have to get so many other vaccinations.
Yes, exactly. To participate in school, to be to be in a community. And again, it's looking outward a little bit. I know a lot of people take that attitude. There's been very few young people that have died or gotten very sick, and why would we do this to our children? We don't know we don't know the consequences of not getting vaccinated or getting. So say they do get this virus and it's mild. Well, what does that mean down the line? Are they going to have issues down the line related to the virus the same way they might have issues down the line related from a vaccine? Yeah, there's just so many unknowns, but looking outside of yourself, I think, is important, and it's a little hard to, just because people are dying that are much older. Mm-hmm. I mean, that's the majority of patients that are dying are in the older population. Does that make it okay? Yeah. Does that make it okay for us to say, all right, well, they're old, they can go? I mean,
it was their time soon.
Yeah. So
no, that's true.
I've seen my mom had COVID and she suffered losses, lost family members, lost friends. And it's very, very hard when that all comes down at once and you're very isolated and alone to begin with. And then you're losing people to this virus. It's just, and I've had doctors, friends that work in the hospitals, and they're the last people to talk to someone. They're the last people to see someone before they die. Their family can't even be there. They do a little FaceTime thing and
I didn't like how you couldn't have anyone in the hospital. Yeah,
well, there wasn't an option. Yeah,
but that must take a toll on those workers.
Oh, emotionally, I don't know how these people in that setting. That's what I mean. That setting is just extraordinary to me, and I was kind of thankful that I don't work in the emergency department anymore. But I felt a little bad about not being there too. So, but it must have been and continues to be an overwhelming thing, and as they're sort of gearing up in other hospitals in Florida, I know the numbers are coming up, and their hospital admissions and all that stuff is rising again. So it's really, really it takes a toll over a long period of time when you don't see an end. And you can't see any clear
light to the tunnel. This makes me worried because at the beginning we thought the virus was way more deadly than it was,
right?
Which makes me nervous.
Yeah,
because if it's still wiped out, like what happens when another virus does come around,
right? Or when it becomes more deadly or more.
So
more
what do you think? I mean, I don't know. There's no answers because even the government didn't know what to do. But like, what would you think would be the best way of going about if another thing like this happened? Like, would the lockdown be the way about it? Because it seems like that hurts so many people.
Yeah, and again, I think the people that have to look at there's so many things that are involved, and I think until we get, the only thing we've been able to move a little forward with is vaccination. And I know no one wants to hear, those people that don't want to hear it. Yeah. And I don't know how you get through.
I don't think you can.
I don't think you can.
You can't change unless they want to change.
Right. And I don't know, I feel like we're just in this wait and see pattern, and there's nothing, I don't know if there's any simple answer. Yeah, lockdown has been a tragedy for so many people and so many businesses. And not only that, those people that work for these businesses now don't have health insurance providers. Like, so we're creating a whole nother nightmare within the nightmare, joblessness, homelessness, no health insurance, which I thought we were talking about a little bit more of that. We'll get there.
Yeah.
But we'll talk about that. But that's, it layers out to so many different things of.
I was actually just about to ask before you said that. It was just, because I don't get healthcare.
Oh,
because like, what does it do? Like, can you just explain it in what it is now before we get into what it should be?
Yeah, it's very hard to simplify a system that is built on non-transparency, honestly.
Oh, really?
It's really I mean, if you have to go to the doctor, do you have any idea what you have to pay the doctor?
No.
When you go to the pharmacy, do you have any idea what you have to pay for that drug?
No clue.
When you have to get a surgery on your broken jaw, did you have any idea what that was going to cost you?
No clue.
Like, right. Yeah. No clue, right? It's a completely ridiculous system. And I am no public health expert at all. I am not I don't know how we address this, but we've been trying to fix the problem of health insurance and access to care, and for so long at a government level, because I don't think doctors have time to deal with it, honestly.
I think they have a lot more on their plate.
Right? Doctors went into medicine to be doctors, not to be business people and policymakers. And unfortunately, the medical lobby is not strong. Our government representation is not strong. So we're dealing with many, many different industries involved in the delivery of healthcare. The doctor-patient relationship is a very small piece of the puzzle, seriously. But how do we address problems of a system without addressing all of the pieces in the system? And I think that's what we're missing. I mean, we keep circling back to affordable healthcare and tax credits to get insured. And, it seems to all be like trying to just move money around and fix things by doing that.
Yeah.
But you have industries like big pharma, like private health insurers, like medical device companies, like EMR, electronic medical record producers. You have so much capitalism and competition.
Yeah.
And these are profitable, very strong, profitable industries, right? Yeah. So you have medical malpractice, lawyers, so many things involved in that. And when are we going to start reforming some of the systems within our system to fix our system?
Yeah.
That, to me, is the answer, very simplified, but we can't allow these industries to all continue to be huge for-profit labs,
no
pharmacies. I mean,
why would public health be something for profit?
Right.
Like, that doesn't make any sense.
So we live in a society in the United States where we're used to immediacy and we're used to paying for and getting whatever we want when we want it. So people will say, well, public health systems, you're not going to get that. You're going to have to wait 6 months for your heart procedure or whatever. And you're going to, and I get that maybe we need to have two systems, right? Maybe we need a public health care system, but it needs to be much more robust than it is. And you need to encourage physicians and doctors and nurses and people to work in it.
Yeah.
So how do you do that? Well, make their training affordable. People come out of medical school with undergrad medical school, $300,000 to $500,000 of debt.
It's ridiculous.
How are you going to go to work and for very little with that kind of debt? So people are driven to keep going and try to make money. I mean, to just exist. So how do you do that? Well, so then let's do that. There's lots, like you said, doctors want to be doctors. I know a ton of people, including myself. I still just do clinical medicine because I love it. I don't want to do administration. I don't want to run a business. I don't want to practice. I don't want any part of it. I want to see patients. I want to treat patients. I always like the challenges in emergency medicine, and whatever rolls through the door is the next thing, and you just deal with it and figure it out. And so, that's what a lot of people went into medicine for, right? And so if you provide education and training and say, listen, you're going to work in the system. We're going to pay you a good salary, right? So that you can live and have a nice life. But this is your commitment to public health. Now you're going to be employed by whatever, our system. So, and everybody, like, I think a ton of people would be interested in that.
Yeah, they'd be stoked.
Right?
Yeah.
People would start going back into medicine. Because for the real reason of medicine. So, I mean, I think that's one idea for getting on track. And when it comes to the other industries, I mean, we need to have reform. You can't have, people need cancer drugs. They're like the most expensive drugs in the world. They're completely unaffordable.
There's just like that one guy who had, I think it was a pill for diabetes or something. I don't know. But it was the only one on the market. And he was like, charge $1,000 for it. And they're like, lower it. He's like, no, it's mine.
Yeah.
Like, what? Like,
that's
how
what
is
I mean.
That allowed?
This whole branding and, I mean, I'm a big fan of generics, whatever's affordable.
Yeah.
I people need medicines, and to not be able to get them because they cost too much. I mean,
So
in the
scummy.
most necessary medicines. And I'll tell you a little snippet story that explains some of the wacky reimbursement practices in medicine. So my dad had cardiothoracic bypass, surgery after he had a heart attack. And it was a triple vessel bypass. And it was, emergency procedure. And he went and had that done. And then, you submit that through your insurance and you get your explanation of benefits and you see how everything gets paid out through your insurance, right? And so he reads that explanation of benefits. And maybe 6 months before that, a year before that, he had a procedure that was done by his urologist in the office. It was an office-based procedure. The doctor didn't even have to run the procedure. The nurse ran the procedure, but it was a new procedure. It was some new prostate procedure. So when he looked at and compared those two explanation of benefits, the doctor that did his life-saving cardiothoracic bypass surgery was paid less than the doctor who didn't even do the procedure in the urology office. So he took that to his grave with him. That bugged him to no end, and understandable. So why because some medicine's new or some procedures new, you're going to pay like 1,000 times more than the market value or what it's worth. I mean, it's just, that needs to change.
Yeah.
Right? I mean, we have so many, medical devices. Like if you ever make everything transparent, that's my hugest thing. So when it comes to, go ahead.
I was just going to say, like, because I don't understand, like, because I'm very new to the working world.
Yes.
So I don't get, if I work for a company, they give me health benefits, and does it differ on the levels? Like what do you get?
Yeah.
Like,
so
why are there different levels of healthcare?
And again, that becomes, someone selling you a product like any other. This is an insurance product. So if you go back to, like, I remember conversations with my grandmother, and they would refer to health insurance as hospitalization.
Okay.
Which, if you know the word insurance, makes sense in the setting of healthcare. Hospitalization, surgeries, things that would be costs that would exceed what a normal person might be able to afford. You're insured for those godforsaken things that might come up.
Yeah.
Right? That could take your life and you need emergency appendectomy, So you purchased insurance for that. Otherwise, you paid for your services as you went along. You got your medicine at the pharmacy, you paid. You got, there was no contract with a private health insurance to get those things. You had insurance for the catastrophic and exceptional things. So now insurance, you have to have it to get any kind of care.
Really?
Right? So you have to, well, I mean, yes, you can pay out of pocket, but you're going to pay, some offices have fee schedules for, self-pay patients, but you can't afford it in this system because I go to my doctor, I get routine blood work, LabCorp, they draw my tubes in the office, they send it off to the lab, they get spun on a centrifuge, they get put in a machine and spit out a bunch of numbers, and my routine blood work in a year gets reimbursed by my health insurance company on the order of $1,500 to $1,800.
What?
For what?
Yeah.
And my doctor's getting paid $200 for my visit.
So the healthcare is just getting all that, like the company?
The LabCorp, Quest, these are, again, big companies that are working in the free market. And how does that get reimbursed at that rate? That's insane. I mean, there's technicians working in a lab. I mean, yeah, you pay your. I don't get it. So there's much I don't get, James, and I'm a user and a provider of the system. I'm frustrated by both. As a provider, again, I have limited, and this is why I chose emergency medicine, really, for leaving it all somewhere else. And I do think that people would be involved, and good doctors would be enticed to be doctors or excited to be doctors and not deal with it. Yeah, I chose emergency medicine. It was like the only world I could live in that I didn't have to deal with it. But the world of medicine has changed too, and people can't even be in little small practices anymore on their own. They can't compete. You have to have volumes of patients in order to have contracts with these health insurance providers to pay. You know, like you have, I have 100 patients in my practice. Okay, well, we're going to pay you, for a regular visit, $75. But if you have 1 million in your practice, we're going to pay you $200 for an office visit. Like, so it's a negotiation with the insurance companies and the healthcare providers. There's so many layers that need to be addressed. I don't even know how to, it's coming out all convoluted now because it's really hard because one thing leads to the next.
Sounds
it just
like
keeps
a shit show. I don't know.
It's exactly the perfect description. Description. But so why not make things a little more transparent for people by, listen, there are so many redundant services in our system that totally needs to be changed. If you look around and you drive around our area, you'll see, 20 different pharmacies in 5 miles. You'll see 20 different lab places in 10 miles. You'll see radiology facilities. Why do we need so many different facilities, right? Why do we, and why can you can't find out, like, if I need an MRI of my knee, can I call this company? Are they going to be able to, is that site going to be able to tell me how much it's going to cost me? No.
Yeah.
Nobody freaking knows. And people go, it's, surgery centers. You have all these little industries that have popped up so that the owners can make money. And some of them are physician owners. Don't get me wrong. There's, you got doctors that are sick of dealing with the hospital's OR thing, and they go to their surgery center, and they're owners of those surgery centers. So they're encouraging people into their centers. They're encouraging people to go get MRIs at their places that they have money, financial interest in. So, I mean, there's a lot of stuff that goes on that's all money making.
Yeah. Because even with my face, they send you to different places to get the same stuff done.
Right? How frustrating.
Can you just share it?
People come to my urgent care with a knee injury, and I'm like, listen, I can try to get you an MRI, but guess what? I'm not going to be doing your knee surgery, so you can get this MRI, and guess what? If you go to this surgeon, he may want an MRI at his place, so then you're going to have 2 MRIs, and we've just wasted money, time, not radiation MRI, but, some procedures, radiation to the patient. You think about, what are we doing? It's horrible. So why can't we have a system that, again, you need a much more robust public health system. To me, that you can't do anything without that. You need reform. Listen, there's good doctors, there's bad doctors. There's good good nurses, bad nurses. Bad things happen though in life, right? Yeah. So medical malpractice reform, we don't talk about it enough. But
what is that?
So, you can get sued for stuff that is ridiculous. Mm-hmm. I mean, you had no part in. You just happen to be in the OR or something. Everybody gets pulled into lawsuits.
Yeah.
So much money, so much waste. If we can create, which we have, clinical guidelines for diseases, if a doctor follows and a nurse and everybody follows the clinical guidelines, the case shouldn't even be brought to court.
Yeah.
There needs to be a board of people that are making those decisions, that are knowledgeable, what even goes to court, and there's got to be caps on how much you can, a person can sue for, right?
Yeah.
I mean, if there's wrong done, of course, everybody needs to be, make amends and do whatever, get whatever financial they need, compensation. Yeah, I mean, but you can't have a system that just keeps sucking money and sucking resources and making people do redundant things, making people over-test and over-refer. We spend a lot of money, what they call cover-your-ass medicine, right? And it's a shame. Like, I mean, for a very short period of time between leaving the ER and doing urgent care, I did a house call practice on my own, which was really fun.
Yeah.
The kids were really little, and it was just some way to stay in it. But it was a total word of mouth, and I would go around with my little black bag and do, little checkups. Kids had ear infections or did some stitches. I had a table and did some suturing. And so I loved doing it, but I was tiny and I couldn't be in health insurance. So I couldn't grow that. But again, that's a field that like big medical practices should have those people going out into because you have older people that can't get to doctors.
Yeah. Like my grandma.
Yeah. She can't get there. And why not have providers, physician extenders, nurse practitioners, PAs? There's a ton of people that could be out there, nurses in the community providing healthcare and keeping people out of the ERs where the expenses become insane. So access to health insurance, but access to actual medical care is another issue.
Yeah.
My God, every time I get to a little bit into an issue, there's another issue.
There's just so many because it all seems
so
like it's built
issues.
off of the foundation of trying to make money,
Yes.
which I think is the biggest issue.
Right. That doesn't really make sense. Taking care of people in healthcare and capitalism really don't
work.
Mesh at all.
From like a human standpoint, I feel like everyone should be able to come to get help for their bodies and medicine for pretty cheap, if not free.
Right.
Like I think everyone deserves the right to be healthy.
Agree. And that's where I believe that, listen, there are there are areas of the country where you don't have the services that we're used to around here, where you have every multi-specialty group and blah, blah, blah. But you need to have, encourage people to, physicians, healthcare workers to be in the system everywhere and that, equal access. And we can change, things need to change when it comes to that transparency thing. To me is huge. Like if I'm going for a general physical exam and I live in Manhattan. Mm-hmm. Okay. So say it's going to cost, say it would be a $200 visit. I'm just talking about the doctor visit, $200 visit, general physical exam. Okay. Well, you live in Oklahoma or Idaho, take that down by the cost of living. Mm-hmm. So it's going to be 200 here. It's going to be 250 in Manhattan. It's going to be 150 in wherever, suburban, if you need an echocardiogram, you should be able to look it up by geography, by place that you can get it, and say, plug it into a system and say, this is what it's going to cost me. I had a family member who got a prescription from the doctor, went to go get the echo, just went to like the local hospital place, got it, and it was something on the order of $1,500 bill to the patient because they went to the wrong place. They said, well, if you went to this outpatient place, it would have been $50 copay. Like, so navigating the system is not easy for users of the system. And
it's so confusing.
It's totally confusing. It's a very, and so I think when we talk about all these things that they try to fix with tax credits and get, people still don't understand it. Like they just want something that they can understand.
Yeah.
And where can I go and what's this going to cost me? Is there any other industry that works that way?
Yeah, you go to the grocery store, you pick out some apples.
Yeah, you fill your basket. Yeah, see what you get at the end. Yeah. See what that costs you when you get to the checkout. Yeah, when they just scan everything.
At all.
Makes no sense.
And also, so is this because, like, why do you think this is? Why is it so confusing?
Well, I think that people want to hide stuff.
Yeah.
They want to hide the cost of medicines. If you ever see a hospital bill and you look at what they charge for Tylenol and stuff, like, it's sick. And medical device companies, they're making a ton of money, but no one's thinking about them.
Yeah.
When you get your hip replacement, they're not, oh, that piece of thing costs what? That costs a lot of money.
I bet. Because they know it costs a lot. I kind of have a problem with like big pharmaceutical companies because they're just using everything to make more money.
Yeah.
And there's the whole thing going back to COVID. There's this medicine. Oh, I forgot what it's called. But there's these two scientists.
Remdesivir or ivermectin? Or talking about
ivermectin,
right.
Which makes no sense to me. That these people, these scientists like Weinstein and another guy that were like on the COVID, like working on it. They're like, use this. And then they get censored on their platform. Like YouTube kicks them off. Like, you can't talk about this. This is misinformation. And they're the ones studying it the most. They're like, this helps.
Yeah.
And they're not using it because it's like a generic drug that anyone could buy.
Well, there's more to that than that.
Yeah,
but
I would love to hear about it because I have limited information.
We all have limited information, James. And I'm doing this talk with you, and it's very casual, and I'm not pretending to be an expert on anything. Of this. But
hey, we're bad role models.
There were some studies, and finding that information is always hard. But there were some studies of ivermectin that were done where people were where they studied it, we call in vitro, outside of the body, right? And in order to achieve the effect of the medicine they wanted with regard to this virus, the doses of it in life, in vivo, would be totally toxic to the human body. So the logistics and reality of actually using that drug, even if it may have been effective in the lab, may not translate into real life. So you have to understand, like, one medicine may be used for something at a certain dose and be effective as an antifungal medicine, but then to use it in a different way, it may not be the same, and the toxicity and stuff involved in that.
That makes sense.
Yeah.
So on a different note then, one of my problems I have is just, it seems like in today's world, everyone just treats things with medicine. Like, oh, you have, you can't sleep at night. Here, take melatonin. Like, you just shove medicine down people's throats.
And again, that's another problem with our healthcare system. We've gotten away from the time it takes to sit with a patient and interact and know your patients and work with them and know what they need. I go to a doctor who's one of the few left who he's pretty much out of all health insurance now because he's got a very established practice, and I spend an hour with him at my checkup. That doesn't happen. And unfortunately, as things have changed in medicine, and like we talked about, in order to survive as a practice, it's very hard to survive as a small practice unless you're like him, totally established, and his patients are willing to pay him a couple $100 to see him. But the rest of people coming out have to join these big mega groups, and they're scheduling new appointments every 10 minutes, every 10, 15 minutes. I mean, I'm seeing right now in COVID, it's insane. I could see 10 patients an hour, and it's been nuts. But, it's very difficult. Take me back to your question.
Shoving medicine down.
Shoving medicine, right. So do you know how easy it is to write a prescription and get a person out of your office? Very easy. Because people come in expecting a prescription half the time. I spend more time in my day talking to people about viruses, that antibiotics aren't going to help, than I do anything else in my life. And, as a practice, I work for a company that I love called CityMD. And as a practice, we are very serious about antibiotic stewardship. That's one of the, first things people come to urgent care for. Antibiotics for their sinus infection, for their cold, for the this, for the that. And we spend a lot of time. And again, COVID helped a little bit because I'm like, so this how sick you can get with a virus, right? Just because it doesn't mean you need right. So you have a virus now, and a virus, the natural course of the virus is this, blah blah blah. This is what to expect. This is what you're gonna do. You're gonna treat the symptoms with this, this, and this. So I spend much more time. For me, I could have write Z-Pack here, bye. And been like, save myself a lot of aggravation. But it takes time, it takes effort, it takes frustration. People get pissed at you when they walk out without a prescription. We do something called, we do a little, we try to work with people and I do a wait and see antibiotic. I'll send it to their pharmacy. I'm like, it'll be here for 2 weeks. please go through this for the next 7 days with me. No cold goes away in a day. We're immediacy. Your generation is nuts. You guys want, yesterday, what, you're asking for today. So it doesn't work that way. Mm-hmm. Health and illness doesn't work that way. So you have to be patient. You got to get through stuff. But people are demanding, and doctors and practices are driven by patient satisfaction scores too. You're judged by how happy your patients are. And, unless you have a good established relationship, like my doctor, he barely prescribes any antibiotics for colds and respiratory things because you don't need them. But it's a fight. And it's unfortunate because it's been taken away from the doctor-patient relationship has suffered from all of the changes over the last many years, which are technology and
because now people look stuff up online and they think that they know.
Oh, absolutely. WebMD, they come in telling me what they have. And I said that too. Like, that's where I talk about clinical guidelines. Listen, I worked in the ER. We saw lots of kids that fell and hit their head. We're not going to CAT scan every kid that falls and hits their head. You have to use clinical guidelines. You have to use clinical judgment. You have to give proper discharge instructions. So there's a lot involved. But if you just do that to everybody, but people come in demanding stuff, okay, and I'll be like, great, you want that? Write the check, go over to the radiology department and get it. Like, that should not be on the healthcare system's cost to do that because you want it.
Yeah.
I'm like, you didn't go to medical school and residency, why should you get that? Just because you're demanding in my face, I mean, listen, if you have true concerns, or the kids, there's something off, of course, but, and I always trust a mother's judgment. That was probably a bad example, but people come in wanting what they want.
Yeah.
Because they want it and they read something on WebMD or, come on, that's what I mean. Yeah. We have to be empowered to practice appropriately to save money. The system costs way too much money. We spend way too much money in healthcare compared to any other country, and
how do other countries work?
I mean, I don't even want to get into that, but I mean, yes, other countries do have much more robust public health systems. But, they got their own problems, too.
Everyone's got their problems.
Everyone's got their problems. I mean, we're very used to something here. We're never going to go to a complete public health care system in our country. But let's accept the fact that we need to get so many more people access to good health care, like you said. Why can't we have two systems in place? If people want to pay for private insurers and get more services, maybe quicker, fine. Let them pay if they can pay. And if they can't, give them a better system to get care. But it's got to change so many levels. Yeah. I mean, like you said.
So do you think if that did, say we're in 2050, 2100, and that there is two systems now, the private and the public, I feel like a lot of doctors would go to the private to make the money because until it changes at the education level, until you have to not pay so much.
Right. Well, it has to be, things have to happen at the same time.
Yeah.
Yeah, we can't trickle in because we do have a public health system. I'm not saying it doesn't exist, but it's not people are not attracted to it
because how could you? You can't.
Because you're in the same. Yeah, you're coming out with this debt. You got to make money. You got to eventually pay down your debt and move on. And you're already, how many years behind the 8 ball, having gone to school, residency, specialty training.
You're so old.
All that. Yeah.
You're so old. I went to Kentucky, and one of the chaperones with me was a cardiologist, and he was like, "Yeah, I went to college, then I went to residency, then I went to another 4 years, then another 2 years.
Med school, residency, fellowship. Yeah.
And then the heart. I'm like, oh my, this guy didn't start work until he was 35.
Think if he was a woman and wanted to have children.
Yeah.
Somewhere along that line. Yeah. Right. So, things have to change.
They should be paying you.
At a bigger, and everybody wants to ignore all the elephants in the room, all those industries we talked about that are profiting and making money. But those are very strong political lobbies. Those are very, very strong. Yeah. And how do you break this down? This is not easy.
From what from my knowledge, which is not a lot, it seems like, because this happens for scientists too, like the government makes policies, like these politicians make policies about the environment, which they have no understanding of.
Right.
And the scientists are like, what the fuck are you doing?
Right.
Like, this makes no sense. So I feel like there should be a committee of scientists that know the shit, and they come in and they give God. There probably is, but they need a stronger role.
But they're not.
Yeah, they're not listened to.
They're very easily brushed under the rug or disregarded because of the lack of power.
Yeah,
truly. I mean, I don't know how that changes either. But you know, we all know we've got major issues, but I don't feel like anybody politically deals with the biggest ones that are, you know, where the money or the gravy train is.
Because that's the hardest to change, and people like the money. So
yeah,
that's why I love following the money is the easiest thing to do. It's like, where's this going? It makes so much sense.
Yeah.
It's like, oh, I just figured out why you're doing this.
Yeah.
Oh, I was watching the Toon Squad, the second one, the new one with LeBron. I couldn't even get through it. It was all sponsorship.
Oh,
it was
my
Nike,
God.
Nike, Audi, Mercedes.
Yeah.
I'm like, this is just an ad.
You're not even seeing.
I'm like, this is terrible. This is terrible.
Yeah.
This is just an ad.
Ugh.
But it's really just all about money, and I think that's the root that we got to change first, and then after that, people will start to see what the problems are, because then when you're not following the money, you could actually do what's right.
Yeah.
But,
I mean, you talked to your Aunt Diane, who was in medicine, you know, and retired maybe in the last 5-10 years or whatever. Yeah. I had a conversation with her, and she, you know, she's just like, oh my God, it just became so different. And I saw it in my years too, where like when I started in the ER, you know, I don't know, things were, you felt like you were being a doctor. You really had time, you had, you know, and then as the healthcare system, things got worse and people had less access. You got overwhelmed with stuff, and you lost the patient-doctor relationship is just broken. It's just broken. You can't spend the time. You can't do it. I know doctors that work all day seeing patients, and then they spend hours, and your sister said this, your aunt said this too, hours at the end of the day just going through and doing your charts. Like you don't have time to do it while you're with the patient, and it's the worst thing. So we have a couple things I like about our company and the way we set it up is that as an urgent care, it's often people's only access to healthcare when they either don't have insurance or often can't get into their doctor. People get sick and they call their doctor and they're like, okay, we can see you in a week and a half.
Yeah.
You're like,
what?
I'm
sick now. Yeah,
right. So we see a lot of people at that, you know, first access point. And so we have it set up that in our office, and you've been there as a patient, there's medical scribes.
Oh, yeah,
so you have someone sitting at a computer working and inputting all the information while I'm sitting there talking to you.
I like that.
And how often do you get that? You don't get that anymore. You get a doctor having to like sit at their computer while they're in their office because, you know, these smaller practices can't afford scribes and stuff. And, you know, my mom's like, yeah, I looked at my doctor's back for the last, you know, 10 minutes while I was in the room, or, you know, while they were trying to chart it all away, and, you know, and you don't get to have a conversation. And that's, again, part of the, okay, I'm going to give you the script and bye-bye, you know, because I don't have really time. You got doctors that I see doctors all the time, don't even examine people. I'm like, what happened to didn't you listen to their heart and lungs? Like, you know, where we lost everything. Like everything is just going to be a cookbook, you know, what are we, animal science? These are humans, you know, like I've picked up heart murmurs on people that they don't know they have. A girl that ended up having heart surgery. She was like a 12-year-old girl. She was having all these chest pain syndromes, and you know, and she was written off for a number of different reasons. And I'm like, you know, what's the story with her murmur? And her parents are like, well, she didn't have a murmur. I'm like, yes, she has a murmur.
Just listen to her heart.
She had heart valve replacement, and they came back and were like so thankful and, you know, preached it, you know, but just like we've lost
the human aspect.
Yeah. It's sad.
We need it. And there's
then we get people to places too. I wanted to finish that CDMD thing. So when I see someone and they come in and they have, I don't know, let me just try to think of something like where they would need to see, all right, so they say chest pain is like a very common, thing that people deal with. And we have to use our clinical judgment, with regard to their cardiac risk factors and their symptoms and whatnot. Or there's someone I got to send to the ER, I can do my EKG and get a little information. But, you have to make those decisions there. And then I am able to, instead of having to send a lot of these people to the ER, because that's where the costs get exceptional, I'm able to work within our network to get people to the provider they need to. So like I can get someone to the cardiologist the next day. Like our office, and again, people don't realize how helpful that is because, well, people do if they've ever had to find, because you can call a doctor's office and like, oh yeah, we could see you in, 3 months. So we, as a first line, physician provider, evaluating the patient, I can determine, the degree. Do they need to see the cardiologist today? Do they need to see them in 2-3 days? We have like 3 different levels of referrals, or routinely in a week or so. And then we have like an off-site aftercare department that just mans the phones and does all the bullshit phone calling with the insurance companies and, getting someone in their network and then calling the office and then scheduling them an appointment. Like that's really cumbersome. Yeah. So that is like one of the huge things that I love about the company I work in. We're taking people in, we're directing them after our evaluation, not just saying, oh, everybody goes to this, we don't always, we take care of a lot of stuff ourselves, but like when you need to get a stress test for someone, you can get them there with bypassing that whole ER thing. So it's, we're doing the best we can to take costs down, because the highest costs are always at the hospital, right? So you try to keep people out of the hospital, and that's where having, people access to just transportation, or letting people, having these big practices should have extenders into the community, going out, mobile vans, whatever it takes to get their, get their regular care, so that they don't wait too long and then get sick and then end up in the hospital. And it's, people with chronic illnesses do a lot of circular in and out of the hospital stuff, and it's very, very expensive in the long term.
Yeah, that's terrible. So what was the thing you just said, the plan? What's the receptionist? Wow.
So in our system?
No, just I forgot the word for it.
The
healthcare like plan, what they have, to see if it works in their
network.
Yeah, in their network.
What is a network?
What is up with that?
What is a network?
Why does everyone have different networks?
Yeah. So when you get a job, and your employer gives you insurance, they don't really give it to you.
You still have to pay for it.
Yes. They offer you the plans that they participate in. Okay. Which, depending on your family, your age, you will choose which one is going to be more affordable. So you have basically 2 different type of plans. One which is a sort of a high deductible, lower premium plan, and then one which is a higher premium, monthly premium, and lower deductible, and you usually have more like a copay system. So when you have a high deductible, those that's kind of a plan that's going to be cheaper for the year, but you're going to pay more for services along the way. Okay. Until you meet your deductible, your out of pocket. For a family, it could be 5, 6, 7, 8,000. For an individual, it's usually like 2,000, 3,000. So if you say, listen, I'm young, healthy, I go to the doctor once a year, I want to get the high deductible plan and pay less out of pocket. There's still, like, if you had something catastrophic, there's a maximum out of pocket you would pay in any plan. So like, if you're already paying thousands of dollars a year for your insurance, but you're only going to pay maximum, if you had to have a big major surgery, or, you're in the hospital for 2 weeks or something, they're not going to bill you individually beyond a certain number. So there is a maximum out of pocket for anybody who has health insurance. So when you get your plan, it'll say in network and out of network, and it'll cost you a little more to do everything in network or out of network. When we talk about HMOs, that was more out west. We have some here, obviously, but those are more restricted, meaning you can only use providers that are in the HMO, that are participating in the healthcare managed, I don't even know, health management Organization, I think it is. So that means like, so say, I don't know, your kid had some weird thing, and they needed to see this subspecialist. You're screwed because they're not in that HMO, right? So that's where HMOs, people get nervous about HMOs, because there are no out-of-network benefits. You have to go and use the providers in the HMO. Now, how do you know? Like, I mean, you can look up your existing doctors and find out what networks they're in, but like, it's a little bit of a guess game. Like, so you have big networks like in New Jersey Blue Cross Blue Shield, Aetna. There's like a couple of huge providers, and I think that, in order for most doctors to survive, they participate in most plans, and a lot of now these big multi-specialty groups, they have the volume. So they have the patients. They can negotiate with these insurers to reimburse them at reasonable rates for services. It's all a negotiation.
What? So the healthcare reimburses the doctors?
Yeah, the health insurance. You don't get paid. You don't get paid directly. No one writes you a check in the office. I guess, they're paying. You're paying insurance. Your insurance takes the doctor's bill, says, all right, the doctor billed $2,000 for this procedure. We have a contract with this doctor that for that procedure, we pay $1,200. Anybody who's in network gets that contracted rate. If you're out of network, you're going to pay that $2,000 rate. Yeah.
This makes no sense. Like,
I'm simplifying it, but this is
having this middleman,
right? So
doesn't make anything. Make any sense.
Therein is another huge industry, right? That is costing a lot of money. And what service are they really providing?
Not much.
With regard to health delivery, with health. So yes, there are necessary pieces to this puzzle. I'm not saying we don't need health insurance, we don't need pharmaceuticals, we need all those things.
Yeah.
But there needs to be control over how things are reimbursed, how much things can cost, what the value of things are. And again, that's where, unfortunately, the strength of the scientists and the medical boards, like, where are the people? Where is our public health experts? Why are they not sitting on panels? Why are they not telling the reimbursement, the insurance companies, that you are out of your mind reimbursing this urologist more than this cardiothoracic surgeon?
Yeah.
Like the necessary, and this has been a problem with primary care and family practice and pediatrics, the basis of healthcare are the most low paid specialties.
Why is that?
Right. Because it's necessary. Like, because they're going to be there, right?
Sure,
it's just like a cardiologist. They're going to be in the hospital. They're going to be taking care of you. They're going to take you to surgery. They're not going to choose not to.
Yeah.
So it's wrong. It's just wrong, but practices should be reimbursed based on the care they give, how they manage their money. Like, if they're getting CAT scans for every patient,
they shouldn't be getting that reimbursement.
Right. You have to, but then doctors need to be protected too. So if you're going to try to practice smart medicine and limit the use of some of the excessive testing that we do, you need to be protected in that practice, so that if you are following clinical guidelines and doing things appropriately, guess what? When there's a bad outcome, you need to be protected against that bad outcome. Bad outcomes are going to happen. But if you've done everything, checked the boxes, and done things right along the way, no one should be able to sue you.
Yeah, that's fair. But it raises flags for me, because it's like, well, there's not every doctor's not like you. There's some doctors that I would not trust.
But they will have strayed from the clinical guidelines.
Yeah.
But they have to be very clear. Like, we need to listen, this is the clinical and they exist. This is the clinical guideline in the evaluation and treatment of congestive heart failure. Mm-hmm. And, if you're, or acute MI, heart attack, someone's having a heart attack. If you haven't given that person aspirin, you've already fucked up, right? So that's what I mean. Like, there's very strict, very clear ways to treat diseases that we know of. Mm-hmm. But there's always people are going to die. There's going to be things that don't follow the book. Right. And that's human nature. That's the business. But should someone be sued? just because of that, if they've done everything appropriately.
Yeah, you're just trying to save them from that inevitability.
Yeah.
Make it. Yeah.
We're not God.
Yeah, no, exactly.
Right.
You're just doing your best. That does make sense that you need to be protected. That must be kind of scary.
Yeah, that's what I mean. Like all this stuff, I mean, we keep kind of, like, it keeps circling back. Like everything is intertwined. Like the delivery of healthcare, all of the systems around it are involved and affected and play off of each other. So you can't fix the problem by just giving someone a tax credit for getting health insurance. Like it's, you know, I mean, I feel like we're beating around the bush of the big systems that are.
Yeah. This literally reminds me, this is like the perfect metaphor. It's just, it sounds like the human body. It's like you give a medicine to fix because they're not eating healthy, they're not working out, they're not taking care of themselves, they're not sleeping.
Right.
Because we're a complex organism.
Right.
This is why it bothers me so much, just the take this pill to fix you when you're treating the symptoms instead of treating what's actually the problem.
Right.
Like when you're not sleeping well, like, okay, well, are you stressed? Like, or do you work out? Are you 400 pounds?
Right.
Like, what are you doing?
Do you shut down your device at a certain time?
I was like, no.
Right.
I'm like, well,
start with that.
Yes. Right. Try that. It was
Lifestyle modifications require people to be disciplined and, you know, people are lazy.
Yeah.
People just want to live.
You just want a pill that fixes things.
Yes, and just want an easy, quick fix. And it's unfortunate that's the mentality. And you know what? It's so funny. I used to see that with my kids when they were little, and if I was really busy, I'd plop them in front of the cartoons, and they'd be watching TV, and like time got away, and I'm like, all right, they've been there for like an hour and a half, and I'm like, I shut the thing off. They're like, all ornery and stuff. And I'm like, the more like passive stuff that comes in, the constant overstimulation, I think, is so bad. I mean, and it makes people so anxious. And I saw that like at that little level. Yeah. But I look at kids today. I mean, they don't even they can't even sit through a 5-minute doctor's office without a parent handing them some device to keep them quiet. Yeah. Or at a restaurant, you never see a kid just sitting.
I hate that so much. Because my dad was always just like, no phones at the table.
Right.
And now when I see someone with a phone, I'm like,
I know. What's wrong with them?
Like, we're here together. Like, with my friends at college or even my friends from home, it's like we're sitting having dinner together and they go on their phone. I'm like, when are we ever together?
Right.
Like, do you really need to go on your phone right now?
Right.
It's this society is. I'm not excited, but I'm interested to see how these kids turn out because
I'm not excited either.
Yeah, because I guarantee they're gonna all have anxiety and depression and all
James, there are not too many people I see that don't have some medicines on their list. Yeah. When they, we come in and take a health history, and there are a lot of psychiatric medicines on.
But I think that comes from our lifestyle.
Right. It may not be a chemical. I mean, listen. Not to say that there aren't plenty. Yeah. There are plenty of people that do have chemical imbalance, the same way neurohormones and things, the same way you don't have insulin in your system for, diabetes. But right, how do we differentiate the two? And again, I think mental health crisis is beyond. I mean, we don't have enough systems in place for all the people suffering from mental health, and whether or not that mental health is organic or situational, environmental. Yeah. It's obviously a combination, but if we did have enough services and providers in mental health, psychologists and therapists and social workers, we may be able to weed out the people that could be just helped by psychotherapy and behavioral changes, but again, it becomes very hard because what do they have? 10 minutes to meet someone and figure it all out. And
I've been talking to this therapist for like 4 months, and she still doesn't know me.
Right.
Completely.
Right. Jenna it's funny because my daughter lives in New York, and she just found a therapist that they work on like a retainer, almost like you pay them like a rate for the month. Mm-hmm. And you could reach out to them whenever. Like, that's nice. Yeah, like they have, you're going through something, or you need a quick check-in, or, whatever. Like you shoot them a text and they give you it's not like, here's your schedule, we'll see you in 4 weeks or whatever. And, things come up all the time.
Yeah.
And like sometimes you just need just that third party to just talk to, who's not involved in your life, who's not related to you, who's not in your relationship that you're struggling with, or, and that's a really nice way, because, a lot of times mental health is expensive too. The visits, like
gosh, it's ridiculous.
to get to see someone. So this was like, I think they tried to make and I love the system. I hope it grows, because I said that's
a good
awesome.
idea.
Yeah, that's really awesome, because a lot of people have to pay out of pocket for mental health anyway. So she's like, I'll just do this, Mom, and see how, if it's all about clicking with the person too. Like, and if you don't, you move on. You just find someone else, because if mental health is not helpful if you're not, like you said.
If you're not on the same mindset, it's like this sucks.
Yeah.
But I went to my school's, oh my gosh, therapy. It sucks.
Really?
Oh, it was terrible. I'm like, it's just because it's just like students and they're learning.
Yeah.
And I'm like, I get better advice from myself.
Yeah.
Than coming here to you.
Right.
But it's difficult, because I
mean, I guess they try to just deal with the stuff that the gen ed college student might be addressing, but you can't get that deep.
They do their best, but and it is an emerging field, I feel like.
Yeah.
But I do think it needs to be taught from a young age, just because the environments is such a huge issue. Like, because if you come from a family that's not very loving and supporting, like, you're going to be messed up when you grow up.
Yep.
So I do think either it has to be in public schools or somewhere where it teaches you how to, like, deal with your emotions, what they are, like self-confidence.
Yeah.
Like, it needs to teach you how to love yourself.
Right.
Because there's stuff you have to learn, because there's our physical age and there's the emotional age. And I know people that are 60 years old that have the emotional age of like a 7-year-old, because that's when the trauma hit.
Yeah.
And they just never grow past that.
Yeah.
And then you get stuck, and it gets stronger and stronger.
Yeah.
But it's just,
and you don't even know how it's affecting you in so many ways, and relationships and everything. Yeah.
Yeah. My therapist was telling me, it was like, when some trauma in your life could have happened, and it was like a sunny day with a certain smell. And when that smell comes up again, like, you're triggered.
Yeah.
And you're just on alert.
Right.
And you just do whatever, because that's
to
your brain.
avoid it, to protect yourself from
exactly.
it. Yeah.
We're just monkeys.
Yeah.
We're just monkeys. Like, at the end of the day, we're just monkeys.
Oh God.
Yeah.
I feel like part of technology has brought us backwards in that way a little bit.
Yeah.
I mean, like, where sometimes I consciously don't answer the phone when my children call. Because I want to give them a little time to answer that question themselves before I help them through it. I mean, we in business and you watch people, let me call so and so, let me call the manager. I'm like, well, let's see if we can figure this out. Like, maybe we can figure this out right here, and we don't have to call the manager or somebody else. Yeah. Like, we're just it's just a knee jerk to get information. It's just everywhere. So, like, well, let me just go get it. Let me just look it up. Let me just, well, let's try to figure this out. Like, the brains don't work anymore. Like, we've gotten so, digital, robotic. Like, it's
scary.
Yeah.
And it is that instant, because my teachers do the same thing. They're like, the good ones did this. They're like, before you ask us, if you can't figure it out yourself, ask a peer.
Right.
And if your peers can't figure it out, then come to us.
Right.
But now we can just Google it on our phone. Everything's just so instant.
Yeah.
We've lost our critical thinking.
Yeah. And I don't feel like you retain it the same way, too. Like, I'm like, oh, I just looked this up last week. Wait, I have to look this up again?
Yeah. Yeah, right?
Like,
There's something about struggling.
Yeah.
And then learning. Because that's the whole thing. That's actually, like, proven. I'm pretty sure. Don't quote me.
Probably right.
But it's like, when you're struggling with a math problem, to going through of, oh, this didn't work. Oh, this is how you do it.
Yeah.
That's
writing it out, seeing the steps. Your brain is doing more than just taking it in and spitting it out.
Yeah.
Yeah.
And it's going to get worse and worse, too. Because eventually, we're going to get the chips in our head.
Uh-oh.
I'm with you on that. How do you feel about, like,
God.
I'm just curious. Now we're just off the deep end. But with the merge with technology, because now we're doing genetic engineering, which sketches me. I mean, we do it with the mRNA, with the vaccine already.
Well, there's some, like, I know people get all nervous about their DNA is going to be affected. And that's not the situation with this particular, just go back to the vaccine. The mRNA technology is within the cell, but not within the nucleus. It's like it's not entering the nucleus of your cell and changing your DNA.
Yeah, it copies it, right?
Yes, it's in the cell, and it's to, create this antibody response to this protein that they've introduced. That's just the way of getting the protein. There's lots of different ways vaccines were created, from live viruses to recombinant vaccines. So there's been progress in that, evolution of creating the protein, the antigen that we're trying to get our body to react to.
Okay.
So it's just a different way of doing it.
Yeah.
But people got a little crazy once they hear RNA, mRNA. We're getting into, right. So
this is in me.
Yeah. So,
but they are doing like the CRISPR stuff, like the what's it called? The babies. The designer babies.
Yeah,
I don't know if they've
you
done it
probably
yet.
know more about this than
I know, but I'm
do,
just curious from a doctor's perspective.
I think there's a fine line. This is a huge ethic and moral and scientific, convolution of. We got to make some real big decisions about where do you draw the line, and who are the people that are going to draw the line?
It doesn't seem like anyone's drawing the line.
Yeah,
it seems like it's just
even
let's
when
advance.
Fertility, became a huge issue, and fertility clinics opened everywhere, and people were doing IVF and they're getting implanted with multiple, embryos, in vitro fertilization. When we had, which is still, listen, people want to have babies. People are having babies later. People are losing their ability to become pregnant. Yeah. So fertility research and the explosion in that field over the last 20 years, has been massive. But how many embryos is it okay to implant into somebody? Are quadruplets and quintuplets, and what are the healthcare, consequences for those babies? What are the healthcare, not to get back to cost, but what are the finances of preemies being born, and caring for them for months in the hospitals and incubators? Where do we draw the line? Where are things? Who's making those decisions? What is?
I don't think anyone is.
Yeah, I'm all for research and development when it comes to genetic stuff, because that is definitely probably the future of a lot of disease applications, cures, and things. Right? We need to understand that, but the whole baby thing, that's a different.
Because it's literally just it's like a slide. I don't know, a slide, maybe water slide. I like water slide better because it pushes you down. But because you first start off, you take the birth defects in a baby.
Yep.
That's the first step.
Right.
But then when is it like, oh, I want blonde hair.
Right.
I want brown eyes.
Yeah, 6'2".
Yeah, 6 foot.
Right.
Nice tan. Like when.
Right.
Because then it's.
People were choosing sex of baby, and right. Yeah.
That's sketchy.
You can't do that. Yeah. Listen, I saw that. Not anything we control, but how these crazy parents want their kids to be the best of the best at everything and the greatest athlete in their class and whatnot. So I don't want to specify specifically, but you could be in a small community where in a small school, it affects a lot of people if you mess with natural selection, right?
Yeah.
So kids were born in a certain year, unless there's a very specific reason, academically, emotionally, that educators have decided that kid needs to be held back. Mm-hmm. Parents should not be allowed to do that.
Really?
Because I saw that happened in a very small school, where then the class that those kids should have been in was very affected and very dysfunctional. And it was the point being, we can't keep messing with that. There's people, things are to happen naturally and things progress, but if you keep mucking with it,
we're messing with nature.
Yeah,
you can't do that.
It doesn't work out.
Do kids? This is kind of a different topic, but do kids? Because I know trees, like in fruits and stuff, when one ripens, it puts out a hormone and tells the other fruits, oh, it's time to ripen. So then they all bloom and stuff or whatever.
Yeah.
Do humans do that too? Because I feel like I got held back a year, and I feel like I look pretty young. You know,
Yeah.
and I wonder if I was in my grade and everyone's developing at this time, if I would have sprouted.
Oh yeah,
You know?
I don't know of that, James. I don't know the answer, but I doubt that works that way.
Yeah.
I think, you know, yeah, maybe you go back in your genetic line and see how your dad and your grandpa, if they were like late.
My facial hair is still not coming in. I'm 21.
Yeah.
Damn it. Maybe one day.
Yeah, don't rush it. It's nice not have to shave, right?
Yeah, the worst part is I get on the sides and a little here.
Oh yeah.
And I'm like, I just look like a.
Got to get rid of that.
Yeah, I'm like, this looks terrible. Can't even make anything of this. But
yeah, I don't know of that one, but that'd be an interesting.
That would, yeah, because
puberty got moved up, we know, from external hormones, right? Like, so girls are getting their periods much younger than they did back decades ago. Probably our food supply and all the external hormones that are coming into.
It's a shit. I keep saying, but like everything is so bad, because I was listening to this scientist talking about like microplastics and how we're consuming them.
Yep.
And it literally ruins our fertility rate.
Yeah.
And I'm like, well, we can't do anything about it, because even when we eat the organic food,
right,
it's like, well, they're getting sprayed with pesticides and there's a round off. And even when they don't, the runoff from whoever else is using it goes in the rivers, gets evaporated, and rains back down on them. It's like,
we're getting very doom and gloom here, James.
I know, but that's the way the world's looking right now.
I know, it's very, very difficult to know what the right decisions are for yourself, for your family, you know, with regard to foods, and that whole industry is just, you know, every time you turn around, well, I can't eat beef, but now I can't eat poultry. Now I can't eat fish.
I'm like, what am I supposed, like, literally, like, what am I supposed to eat? Like, I try to eat healthy. It's like, well, I know I can't eat Cheetos.
Right.
Because but like, now I can't eat salmon.
Maybe, will it really matter? Maybe I should go back to my devil dogs.
Yeah, right? Exactly. But that's another thing. It's just, how are we supposed to be healthy when the food we eat's
it's really bad.
Terrible.
Yeah.
And that's to make money too.
Right. We got away from all this mass production, the waste. I mean, think of how this world, I mean, listen, we go back to being hunters and gatherers, and we'd all be okay growing our own, but who's doing that? We got to be out working, making money.
Exactly. We don't have
to
time
mass
for
produce,
that anymore.
to waste.
Yeah.
It's like a vicious cycle of.
It's so bad. It's just a materialistic
I don't know
society.
how to, I can't even, you know, I used to be like 10, 15 years ago, I'm like, oh, it'll circle back. Things will settle back. Things, you know, when you get caught up and your kids are little and you start putting them into these programs and you're like, oh my God, what are we doing? We're like spinning our wheels 7 days a week for nothing. And the race to nowhere, right? It's just truly disheartening. And when you're doing it, sometimes you don't even know you're doing it.
It's just until you
back away or withdraw. Like, my kids were swimmers in the beginning, and it was fun. They loved it. They went twice a week. It was good exercise. Next thing, you know, they become a birthday passes, and all of a sudden they want them there 5 days a week. And they're like, I hate this. This sucks. I don't want to do this. I'm like, I don't either. We're out. Yeah. You know, but but then you're caught in this vicious cycle. If you want your kids to be healthy and where are they going to get the activity? Like, it's just like, it's very hard to make decisions as a parent. You think it's hard enough for yourself. Wait till you have to like figure out how to navigate this world for your kids. Yeah. And I don't even know half the world you guys do, because I am very opposed to, and I don't need it in my life because my life already exists. But you guys are growing up with technology, social media, all that stuff. You can't exist without it.
Yeah, you really can't.
Right. I've never had to market my practice. I work for, I'm an employee. So I don't have to be on anything. And I thank God for it, because it would drive me bananas. I mean, I know I got on Facebook once to go to my college reunion, my 20th, to get all like the information. I got home and I'm like getting these beeps and things, and I'm like, what is this? And that was it. Face off, sign off, done, out of Facebook.
If I could, because this is my favorite part of what I do, is this.
Yeah.
But then after, the editing's fun too. But then I have to go post it on Instagram, post it on YouTube, post it on TikTok. I have to edit it all. I have to look at the feed. How does it look
on that platform?
On the platform, I have to edit it so it fits the square. I finally got a good way to make the clips look good, so that was pretty exciting. But it's all just like marketing. I'm like, this sucks.
Yeah.
Like I like this part.
Yeah.
I don't like that part.
Right. This is why I do what I do in medicine.
Yeah, exactly.
I like sitting and talking to the patient, trying to help them through their problem, trying to figure out how to make them better, and, trying to get them the help they need. But yeah, unfortunately, we need the other systems to work.
Yeah.
They've gotten so out of control. I feel like everybody's kind of just throwing up their hands out of desperation, and it's a sad way.
Yeah.
And
I hope I'm hoping because it's new, we start to understand it more. Like, because the kids are going to grow up and they're going to be like, oh my gosh, this is terrible. Like, we shouldn't let our kids.
Right.
Or we at least need to adjust this.
Right. Well, I think the people that were in those industries, did you see that The Social Network, I think was the name of the documentary?
Yeah, I haven't seen it, but.
But that's where those people who went into this wide-eyed and excited about social media and all the good that it could bring, thereafter 10 years into it, became, executives in these companies very, and totally disheartened by the intrusiveness and the addiction and and do not allow their kids on social media. So hopefully that'll be your generation of parents that are going to be like, it needs to stop.
Yeah.
Our kids shouldn't even have friggin' cell phones. They're going to school and they're in school all day. Why do they need a cell phone?
Yeah. Don't give them
a phone. Right?
Yeah. Or at least give them
my
like
kids
a flip
didn't have
phone.
them until, well, my girls say they were in high school, but my son was in middle school, I think, because he was like the last guy, right?
Yeah.
But grammar school, I'm like,
That's
I would drop them off and
ridiculous.
pick them up. Why do they need a phone?
Because I'm so happy because the phones didn't even come out, I remember, until I was like in middle school.
Yeah.
Or maybe iPhone 1, the first one was like elementary school, but
yeah, no one had it.
So
it didn't matter.
So
Yeah.
when I was in 5th grade, the 4S came out, and like still no one had phones.
Right.
And then like 7th and 8th grade, people
That's
started
when-
getting
yeah,
iPhones.
right.
I'm like,
Yeah.
this would have sucked.
Right?
Before I had to come home and like in elementary school, I'd call my friend on the landline and be like, hey, Mr. Alexander,
James,
can Alex hang out today?
I'm going to make you laugh. I still know the home phone numbers of some of my high school
Really?
friends. The only numbers I remember, I can't remember my kids' cell phone numbers,
Yeah.
but I know those numbers because we used to dial them every day. Like
Yeah.
it was just, yeah.
I like that,
funny.
though. The
Yeah.
connectedness is definitely a great part of technology, but it comes just like everything else.
Yeah.
It comes with so many cons.
And the flip side of it, the isolation that
Yeah.
others feel because they're not connected or
Yeah.
may not be connected.
And I do think that comes back to your mental health. Because if you are content with yourself and you're happy with who you are and you don't
Right.
need others to
Right.
what's it
That's a
called?
strong human, James.
I know,
'Cause
but
human
I think
nature,
we need to teach
yes.
that.
Yeah, we do.
I really do.
We do. But that comes mostly from your parents. You're right. I mean, that comes from your home, and there's a lot of things in life that bring you down, and not too many things that lift you up.
A lot. Everything brings you down. Like every kid's broken in some way, and I do. There needs to be. I think that's what we need to focus on, because all this other stuff comes from like insecurities. It feels like, because if you're focused on money. That's not really the best thing to focus on.
Right.
It's
Things
just-
come from kindness, and you know what? It grows. It's infectious, because
Yeah.
you know what? When I address people, and you're coming up against someone who's already got their feathers up, and they're just I just kill them with my kindness.
Yeah.
And they don't even know how to react half the time. They're like, "All right, doc. Okay. All right. Thanks. Thanks for your help." Like they're like, "I gotta get out of here. I don't know what to do. I don't know. I'm not used to being treated nicely, or
It's nice though. It's cool to be treated nicely. It really is.
Yeah.
I enjoy it, and it makes your day so much better.
I said that someone, my mom was talking about some cranky old man who was in the store in front of her, and he was making a scene, and I was like, Mom, just think of it this way. He's got to live with himself. I'm like,
Yeah.
you only had to deal with him for 5 minutes. I go, so, it's
Not too
over.
bad. Not too bad.
Yeah, right? I mean, we just got to create your own happiness, and there's no doubt. And
Yeah.
it seems like you learned some lessons already from life, and or your therapist, and or your
definitely
mom
life.
and dad. And,
It's definitely life.
Yeah.
Yeah, but I mean, I'm always just like, you got to work with what you got.
Yeah,
This is what I have.
Right. And if you want to believe that there's a perfect situation, perfect relationship, perfect world, perfect anything, you're going to be hardly
There's not.
disappointed. Yeah.
There's not.
Yeah. So no be realistic in your dreams and your, and create your own destiny, right?
That's why I think social media is terrible, and media in general. Because you put these shows up,
and it's like, I should be happy every day.
Look at this guy.
Look at this guy.
Girl. They're so happy.
They're on TikTok. They're making $2 million just for posting a video.
Yeah, they're dancing.
They're dancing.
But then you close the door, and I think it's so sad. But a lot of people don't see it. Like, I don't know if you know Charlie D'Amelio.
No.
Okay, she's a TikToker.
Okay.
But all these like dance TikTok people that blew up that are younger than me.
Right.
They're getting smashed on social media because they're like, oh, you're losing weight, like, oh, you're fat. It's like, but then I'm looking at these girls and their responses, they're like lashing back. So I'm like, they're obviously not old enough to understand that these people are just coming at them from self-hate or whatever, jealousy.
Right.
And they're taking it to heart, and like that affects you so much.
Yeah, you might not think so. You might think you're stronger in the moment, but how much of that can a human,
like 17.
or human,
that messes you up.
Kids, that's horrible.
Yeah, but
all right, what's our high note? How are we gonna wrap this up on a high note?
I don't know. This is like most of my stuff. Like I go into this and it's like, it brings you down. But I do think there is hope to everything. Yeah. I really think there's a light at the end of the tunnel. Yeah. We may be in the dark right now.
Hey, there are good people. There are definitely good people. There's good. And listen, I saw the best in people during COVID. We definitely did. We felt as healthcare workers and frontline workers, you turn on the news and you see people cheering at 7:00 at night in New York. You would go to work and you'd get letters from school kids that, they'd send you pictures. Thank you for, what you're doing. You'd had community organizations that, brought us like food, dinners and breakfast. Nice. And, so there are so many people that are good and, want things to be better too. So I just don't know how that becomes an organizational mass that's stronger than the other.
I think it's just the other right now is just more vocal, and because I think a lot of us just like we feel like hopeless. Yeah. But because we don't talk.
Or you feel like, as an individual, what can I do? Yeah. What can I do to affect change? But it's the small things. It is truly the small things. And, just in your interactions, you interact with a lot of people now. And now you have a platform that, is open to others. So the way you present stuff is very important. And again, when people sort of take a very hard stance and can't see the other side, to me, those are not good people to have.
Not very wise people.
And you know what? There is no strict black and white on so many of these issues.
I feel like there's no black and white. It's all just so you have to like literally just in the conversation today. There's so many different parts
to make up a whole. Yep.
It doesn't. Right. You can't.
Yeah, and those podcasters and those bloggers that are so definitive in their, and so right or so left or so. We're never going to get anywhere. No. And we know how our political system is now. It just
doesn't
defeats itself every term or every time there's a change of administration. And so how do we get to that middle ground that we could actually start to progress?
Yeah, I love the middle. The balance is my favorite thing ever. And that's why I like the private and the public. Yeah. Two different things. Because it's a middle ground.
You have to have, that system hasn't worked. That system hasn't worked. So maybe if we find some some way to meld them or have them work in conjunction with one another. Yeah. Maybe we'll create something.
It could be good. And that's why I like this too. Because I don't know anything. And I have my ideas but I hear someone else's perspective and then I have my perspective and it's like, yours can be, this is what philosophy is all about. I can strengthen your argument or your belief by countering it, by finding the flaws in it. Yeah. And you don't get defensive when someone finds a flaw in your argument. You should be happy.
Right. Show me your reference. Where did you learn that? And I had a discussion with a patient about vaccination this week, and he was a Brett Weinstein fan, and and I listened to him, and he started spewing out stuff, and I'm just like, I'm not sure if that data is real, or I don't know. I said, can you share with me, after we started getting into it a little bit, and I said, listen, probably best we not talk about this anymore here. Yeah. Let's just, move on from this topic, but please, here's my email and please send me, the data and where you're getting your information. I haven't gotten any email.
Because a lot of people just like listen.
They just listen.
And then they just speak.
And why is someone an expert? Because they talk?
Yeah.
I mean, James, I love that have open conversation, but you're not claiming to be. And like
No,
I started
I'm no
this off,
expert.
I am no public health expert. I'm sure people, if they heard this, be like, "What an idiot! What is she talking about?" I'm like, these are my personal feelings about being a practitioner in healthcare, and I just want it to be better, and I loved what I did, and I love what I do because of this little company I found, but I am disheartened that most people can't practice medicine the way they want to.
Yeah.
And it who suffers? The patients.
Yeah. And I like, because we're both obviously like not professionals, and that's why I literally named this Bad Role Models. Yeah. Because like my mom hates the name so much.
Yeah, I get it though. It makes sense.
Because you can't follow.
You're not claiming to be. Yeah, I'm not claiming to be. An expert. You're not claiming to be an expert on any of these topics. You're just trying to, open conversations and
hear perspectives, talk.
Right.
But that's like for anyone. That's why I'm like, no matter who you are, you should never follow anyone.
Right, because they claim, they tout, they act like they are experts.
Yeah,
they act like they have the data, they did the research, they are the scientists, and they're not.
Fact check, look things up, do your own research, because no one is a good role model, except for maybe Jesus. But I think this is a good place to stop. So
excellent.
I really enjoyed you coming on. And we're making time to do this.
Very fun.
Earliest podcast I've ever done.
Happy to be here. The earliest ever.
Yes.
Happy to be that. That's definitely on my timeline.
Yeah.
Me and my children live on opposite timelines.
Yeah.
It's like ships that pass through the night, right? Because this is my time. So thank you for accommodating it.
Thanks for making the desk.
And the desk.
And the desk is very nice.
And we have to thank Mom for taking care of Lucy.
Yeah.
Because that would have been a much more difficult conversation.
Gosh, yeah, she would be jumping all over us. So I appreciate it. All right.
Peace.